I'm Alodia Gabre-Kidan. I'm one of the colorectal surgeons with Johns Hopkins Medicine, and I practice at Howard County General Hospital and at our Bayview location as well. So colorectal cancer is a cancer that starts in the lining of the colon and the rectum, and then spreads through the rectal or colon wall, and then has access to other organs. It's actually a fairly common cancer, and it's pretty undetectable in the early stages, which is why colonoscopy is so important. So colon cancer doesn't have a demographic per se that it affects more than any other type of person or patient. Those that are at highest risk are actually those that have had family members that have had colon cancer or colon polyps. So those are the populations that we pay the most attention to, but everybody in truth is at risk for colon cancer. The main symptoms to look out for colon cancer, the biggest one is bleeding. So blood in your bowel movements, blood in the toilet bowl after having bowel movements, or low blood counts are all triggers that we should be looking for possible colon or rectal cancer. In patients that are average risk that don't have any symptoms, the argument is often, well, I feel fine, why would I get a colonoscopy? And I would just say that our best chance of preventing colon cancer is when it's a polyp. And this is one of the only cancers that we can truly prevent by staying on top of screening. So I've met a lot of patients that have unfortunately developed colon or rectal cancer that never had a colonoscopy that wish, I wish I had stayed on top of that, and they're not so bad. So currently the screening recommendations are to start colonoscopies at the age of 50 for individuals that are average risk. Now average risk would be someone without a family history of colon cancer and no symptoms. The test that has the best chance of catching colon cancer and removing it early at the stage that we want to, which is a polyp, is a colonoscopy. So a colonoscopy essentially starts at the rectum and goes all the way up over to the end of the colon on the right side of the abdomen. That's the best test. There are other combinations of tests that we can also use, like blood testing in the stool combined with a sigmoidoscopy, which is essentially a shorter version of a colonoscopy that only goes up to the sigmoid colon, which is just on the left side of the abdomen past the rectum. Colonoscopy is the best test, that's why we advocate it, but in some patients it really needs to be a discussion between the doctor and the patient in terms of what they're comfortable with and how high risk they are for a colonoscopy. So virtual colonoscopy and other less invasive options like stool testing for DNA samples to see if there's any sort of shedding of colon cancer into the DNA, into the stool, they haven't been proven yet. So they're promising, and they're something that some practitioners are using, but if you go just by the standards, still colonoscopy, fecal occult blood testing, and sigmoidoscopy is what we recommend.